My name is Jennifer Kearns, and I work at the Northern Regional Bleeding Disorder Center in Traverse City. And today we're going to talk about bleeding gums. Okay, so first I want to draw your attention to these little black fibers, these little ligaments that hold the tooth into the jawbone with the gums around it and the nerve and blood vessel coming out the bottom of the tooth. You can see how high these black fibers are holding the tooth in. Your gums are like a little turtleneck around the tooth, and you can get food and bacteria stuck in between the tooth and the gums, kind of down in there up to the first fiber. Now, the more food that you get stuck in here, you can see this one's getting a little bit more dirty. The more food you get stuck in there, the more inflamed your gums become, the more red and puffy, and they kind of swell up. And when they swell up, now you've got a bigger turtleneck of gums going around the tooth because it's taller down to this first fiber. As that progresses, it gets worse. The tooth gets dirtier, the gums get more infected, and now you see these little black fibers are missing. The bacteria kind of eat these fibers. The dirtier and dirtier that tooth gets in between the tooth, the gums, the jawbone, these little fibers disintegrate. And you can see down here, it progressively gets worse. So when you're in the dental office and we measure your gums, we measure from the top of these gums down to the first fiber we can touch. This would be 0, 1, 2, 3 millimeters. This would be 3, 4 millimeters with some swelling. Then you get into 5, 6 millimeters of depth. You're going all the way down here. That's a lot of depth for food and bacteria get caught. No wonder they eat away those little fibers. And as it gets worse down here, you can see even in the center of the tooth, between the two roots, there's not much holding these teeth in. By the time you get down to here, this tooth is pretty loose in the jaw. And look at the bone. You can see the jawbone starting to disintegrate and be eaten with the bacteria as well. Kind of gets destroyed. So there's not much holding these teeth in. So when we clean your teeth, same as when we measure them, we go down in between the tooth and the gums down to wherever that first fiber is on you. And that's how far we have to clean out. So when you're at home, when you floss, it's good to floss in between where the two teeth touch for cavities, but also you have to, really important, get down to the first fiber that you have and scrape out all that stuff and get it out of that pocket. And you can see how puffy the gums are. When you think about it, it's kind of like getting a splinter or a sliver in your hand. You can touch your hand perfectly fine, it doesn't hurt, but as soon as you get a splinter in there, it gets all infected and it gets red and puffy and it hurts to touch it. And then you have to dig out that sliver. And when you do that, it's gone and it heals, and then you can touch your hand again, it doesn't hurt. Same thing happens in your gums in your mouth. When you get food stuck in there, your gums get red and puffy and they bleed and they're uncomfortable to touch. That's why it's so important to use floss to get down in there to those little black fibers. So you want to wrap it around your middle fingers so that you can let go and it stays there just like that. Now you use these fingers to hold it, and you use this little piece right there to floss with. And this gives you a lot more dexterity, so you can get in the back, down in front. You always want to put one hand in your mouth and one hand out of your mouth. And you do this side, and then you go around, you switch, and you do this side. Same thing. Use those fingers and thumbs. If you need a little bit shorter piece, that's good. Now, as you get the hang of it, what you're going to do is you're going to wrap the dirty and unwrap the clean. And wrap the dirty and unwrap the clean. So you're basically moving down this floss. So you're gonna floss, you wrap the dirty, unwrap the clean, and then you keep flossing down there until you get a fresh piece of floss every time you move down the line for all of your teeth. That'll help, especially if you have rough fillings in there that can shred floss. Some tight contacts will give you a nice slippery piece of floss. Now, when we talk about slippery floss, we want waxed floss. Waxed floss is the best kind of floss to use. Other than that, rope floss is kind of woven like yarn. That's okay too, but that can shred quite a bit in some people's teeth. But waxed is very tacky. So it's gonna grip that stuff down in that little pocket, that turtleneck of gums around your tooth. It's gonna grab it and pull it out. And so when you floss your teeth, you kind of want to hug and scrape up, and hug and scrape up those teeth. So you scoop all that stuff out of that little turtleneck there. And with wax floss, it's a lot more sticky. If you get the satin, the tape, the glide, or any one of those really super slippery ones, they often will slip right over the debris and it'll leave it behind, and your gums will still continue to bleed and they won't be as clean. So now, as a note for people with bleeding disorders, if your gums bleed and you're just doing normal flossing and brushing at home, it's okay. It just means you have to work a little bit harder, because remember, you got something stuck in your gums, kind of like a sliver in your hand, and you've got to get it out and clean it really good. It might bleed a little bit, but it's not the same as having a bleed that's due to trauma or injury. So you're not hurting yourself by brushing and flossing vigorously. You can get in there and debride all that stuff and get it out of there, and you will eventually not bleed as much. So it's completely different from an actual bleed for someone with a bleeding disorder. So don't worry about getting in there and flossing really good down to that first fiber to scoop all that stuff out of there. And your gums will turn a lighter pink. They won't be so bright red. They won't hurt as much. And they'll be a lot healthier. And that's what we want for all of our patients. Thank you for watching and have a great day.